So we're going to look at just a couple of exercises here, happy baby and dead bug. And we're just going to start with that lying on your back, reaching up, using the index and middle finger, encircling the big toe with the knees and feet in a slightly wider than shoulder width position that looks very similar to your squat stance. You will try to achieve a vertical shin position. And then using your hamstring muscles to kind of grab onto the sit bone, we just kind of gently pull the pelvis into a posterior pelvic tilt. You can begin breathing really deeply. Try to reach the shoulder blades up and press the arms up towards the ceiling, which kind of deepens the firm contact into the ground from the mid-back. And we just want to go for about 5 breaths here in total. From here, we can relax down and then return to a dead bug setup. So we're going to try to use the abdominals to basically get that posterior pelvic tilt and that same feeling of heaviness. We can continue using the arms reaching up towards the ceiling. Make sure your neck muscles are relaxed, but those arms reaching up is going to take the shoulder blades forward and help press the mid-back into the ground. So we want to feel like a very strong contact into the ground from the mid-back down to like L5 or the belt line area. And from here, we can do a contralateral arm and leg extension. Inhaling as the foot goes out. And we only want to move so far as you get control. So we want to feel like the back is grounded the whole time, and if it starts coming away, then we're not going to continue pressing out further. Also, if you have a big deep click in the hip or low back area, that may be a sign that you can help to kind of cinch that up a little bit more. So we want to use the muscles in the front of the pelvis, cinching up to the ribs, and that feeling of heaviness into the back to give more control, and just reapproach that very slowly. Stop before you feel that kind of clunk, and then return. So you're going to work on getting your control and getting that side to really press deeply into the ground, feeling like there's no change in your position or alignment. So in that case, you maybe want to work on that one side for a few reps consecutively. And then in time, hopefully we'll see improved control there, and that could help to overcome some chronic issues with stability and movement control around the hip and low back. Okay, so those are our key exercises to work on, just kind of opening up lumbar flexion as well as lumbar stability.